Okay, I think we're ready to go. Hello, everyone. I'm Kathy Thompson. I'm benefits consultant for Medicare products here at Walsh Duffield. And I want to thank you for joining us today. And our webinar, HSAs in Medicare, the Rights, the Wrongs, and the Rules, is going to be presented by Paula Vinay Clendenning, who's also a colleague and benefits consultant here for both Medicare and individual insurance plans. This is our second webinar of the Employee Benefits and All That Jazz series. We had a great time hosting in person and sharing insights with many of you at our in-person event last week. To register for our last webinar of the series, you can visit walshduffield.com and /allthatjazz. Before I introduce Paula, I'd just like to cover a few housekeeping items. Today's webinar is being recorded, so we're going to share a link with you after the event, along with the presentation slides. The presentation is approved for one SHRM professional development credit and is pending recertification credit hours through HRCI. We'll email the codes needed for these credits to live attendees after the webinar. We invite your comments and questions. You can use the Q&A box on your screen if you think of a question at any point. So just type that in there and we'll hold for the end of the presentation, and we'll leave some time for Q&A. With that, I'm happy to introduce my colleague, Paula Vinay Clendenning. She is, as I said, a benefits consultant here at Walsh Duffield for Medicare and individual products. And Paula's been at Walsh Duffield now for a little over 2 years. She and I, however, a little side note, have been working together for something like 10, maybe more now, Paula. Time is kind of flying by. She was at Blue Cross Blue Shield for 10 years, and that's where she assisted with Medicare, New York State of Health clients, and hosted educational and networking events within the community. Paula's main focus at Walsh Duffield is on advising, selling, and enrolling Medicare Advantage, Medicare Supplement, prescription drug plans, and other ancillary insurance products. So in addition, Paula is an active board member in the Network of Aging. Today, Paula is going to be discussing the relationship between Medicare and HSAs. We've seen as high deductible health plans paired with health savings accounts gain popularity with employers, individuals are benefiting from the tax advantages and saving towards future healthcare expenditures with their HSAs. However, things can get really complicated, as you've probably seen, when Medicare enters the picture, especially as people remain in the workforce past the age of 65. This presentation is going to take a deeper look into how Medicare eligibility can affect the ability for contributions to be made to HSAs and strategies to help your employees maximize their contributions while avoiding problems with Medicare and penalties along the way. So at this time, I'm going to hand the floor over to Paula, who's going to start today's presentation.
Thanks so much, Kathy, and good morning, everyone. Great to be here. Hopefully you'll find this interesting. I guess I've become a little bit of an HSA geek. So this this is like close to my heart. I've been a fan of HSAs for quite a long time. And, as people who have been contributing to HSAs are nearing Medicare, we seem to be getting more and more questions from both employees and their employers saying, I'm not sure what to do here. So hopefully this will provide some guidance, give you a little more confidence as you're having those discussions with your employees, and talk you through some of the more common issues that we see popping up. So to start off, we're just going to do a little background on HSAs and high deductible health plans, kind of where they came from and where we're at with them. We'll talk about a little bit of, what Medicare is and what the rules are when you turn 65, and what the scenarios look like if you're going to continue working, if you're talking about retiring past the age of 65. Put together a couple of, kind of real life scenarios to jog these situations and make them kind of come to life a little bit. And we'll talk about some resources available to you as well. So high deductible health plans and health savings accounts have been around since 2004. The Bush administration, under the 2003 Medicare Modernization Act, introduced the establishment of health savings accounts as a vehicle to save money for future medical expenses. Like I said, I'm sort of an HSA geek. I got in on an HSA as soon as it was available to me as an employee in the past. So what I like about HSAs is you kind of get a triple tax advantage here. So you're putting money in tax-free, or if your employer, as an employer, you're putting money into your employee's HSA's account, it's pre-tax dollars. So they're either tax deductible if I'm, as an employee, making a contribution and going in tax-free as an employer. You can earn interest on these accounts, and the interest gained is tax-free. And as the money is going out, the money is tax-free as well, as long as it's being used for qualified medical expenses. And we'll get a little bit deeper into what qualifies as medical expenses as we get into this a little bit. What you may or may not know is that the contribution limits, as people near Medicare over the age of 55, they can put in additional monies as like a catch-up contribution to really maximize the benefits of having that medical nest egg available. And the thing to keep in mind too is HSA funds, unlike where an FSA where it's really attached to the employer, the HSA funds belong to the individual, and it's not a use it or lose it situation. This money accumulates and rolls over year to year. So even if somebody is leaving employment, changing employers, that HSA money is theirs. It goes with them and can continue to grow as long as it's being paired with a qualified, eligible, high deductible health plan. So in 2023, here's our little piggy bank that we can save our money in. An individual can contribute up to $3,850. Over the age of 55, you have an additional $1,000 you can throw into your HSA piggy bank at $4,850. Now, if you're in a couple plan or a family plan through the employer, those contributions rise to $7,750 for a family. And again, if the employee is age 55 or older, an additional $8,750, an additional $1,000 to take it up to $8,750 for 2023. In order to be eligible as a high deductible health plan, the plans themselves have to be structured in a certain way with the actuarial values, and everything needs to be subject to the deductible in a qualified high deductible health plan, except for preventive services. To be qualified to be paired with an HSA, the deductible needs to be at least $1,500 for an individual, $3,000 for the family. The out-of-pocket maximum limit there is $7,500 for an individual and $15,000 for the family. So your high deductible health plans and HSAs today, just a couple of statistics that I found interesting. So in 2022, just to show you how popular this arrangement has become, HSA assets, so the money that people have in HSAs in 2022, by the end of it, 2022, surpassed $100 billion. And there's nearly 36 million HSA accounts that were registered in the U.S. as of December of 2022. with 55.7% of American private sector workers enrolled in high deductible health plans in 2021. So you can see the popularity, and people are really grasping what this means for them to be able to save money for future medical expenses. And as these folks become Medicare eligible, we need to be very much aware of how these funds can be used and what the implications are when Medicare comes into the picture. So we talked a little bit about what qualifies as a medical expense. Now, the full list of information on what qualifies as medical expense is listed at irs.gov. But just as a high level, your HSA money can be used to pay for towards your deductible. So if you're, having MRIs done or blood work, paying for prescriptions, doing your vision benefit, even you can use your HSA funds, as I have used my HSA funds, towards things like my contact lenses, for dental coverage, things like that. Generally speaking, and this question does come up quite a bit, whether or not an HSA can be used to pay the premium on a plan. Generally, no. There are some exceptions to that. So if somebody is on unemployment, they can use their HSA funds to pay for COBRA. When Medicare comes into the picture, HSA funds can be used to pay for the premium on a Medicare Advantage plan or on a standalone Part D plan. Now, when you are Medicare eligible, there are two routes that you can take to get coverage to take care of those things that your Medicare straight A and B do not cover. HSA funds, while they can be used for Medicare Advantage, the other type of coverage, a Medicare supplement plan, you'll also hear it referred to as Medigap. HSA funds cannot be used to pay for Medigap. HSA funds can be used to pay for the Part B premium. So if somebody is enrolled in Part B of Medicare, but they are not collecting Social Security, so they're actually paying for their Part B out of pocket, they actually can use HSA funds to pay for the Part B premium. So that's interesting. And a little known thing, something I stumbled across in my research here, you can actually use a portion of your HSA funds toward long-term care policies. So another thing that comes up, people want to prepare for their living situations as they age. Good to know that, there's really a lot of good reason to maximize HSA contributions. And as you're having discussions with your employees, especially if they're getting in young, really encourage them to start stockpiling that money so they have it available for these things. As as we get older, usually our medical expenses increase. So a really good idea to utilize these HSAs. So let's talk a little bit about Medicare. And this is just, again, a very high level. So we talk about what Medicare is. And of course, it is health insurance. So the reason why we get into complications with enrolling in Medicare and contributing to an HSA is because Medicare A and B are considered health insurance. So just as if you have Medicare A or B, you cannot enroll in a separate health plan like through the New York State of Health because you have health insurance. Same goes with the HSAs. When you get Medicare A or B, you're no longer eligible to contribute to an HSA because you have other health insurance. So generally speaking, health insurance with Medicare is available to folks who are 65 and older. However, people who are younger qualify for Medicare as well. If you've been on Social Security disability for 24 months, you become eligible for Medicare on the 25th month of your Social Security disability. This does complicate things when it comes to the HSA contributions, okay? So when we get into the rules of enrolling into Medicare Part B, I'm going to point out a difference between Medicare when you're 65 versus Medicare due to disability. So there are four parts of Medicare: Medicare Part A and Medicare Part B. those are administered by the federal government. So if you see the red, white, and blue Medicare card, that is original Medicare. Part A is hospital coverage. Part B is medical coverage, and we'll get a little deeper into that in a moment. Medicare Advantage, as I said, there are those two routes to take to get coverage for things that original Medicare doesn't do for you. Especially in Western New York, the Medicare Advantage plans, which you'll also hear referred to as Medicare Part C, very popular route to take place of what original Medicare does. And those plans, the Medicare Advantage plans, usually have your Part D built into them. Part D, easy to remember, D for drug. So both the Medicare Advantage plans and the Medicare Part D plans are offered through private insurance companies like your Independent Health, your Univera, your Aetna, Humana, those types of things. So Part A of Medicare, generally no cost to the individual because they've been paying into Medicare through their working career. So the hospital coverage, inpatient services, skilled nursing, hospice, blood that's received while you're in the hospital. So no cost to Part A. However, Part B, which is the medical coverage, it does carry a premium. So we often have those discussions when people are nearing 65 and they're going to continue working. It's, do I enroll in Medicare A and B? So if somebody does enroll in Medicare Part B, for most of them, they're going to pay a base premium of $164.90 a month. And Part B, the medical coverage, you're talking about things like your doctor visits, your outpatient surgeries, your preventive services, your diagnostics. Those are all covered under Medicare Part B. You'll see a little footnote here. An income-related monthly adjustment amount may apply for higher earners. So what that means is folks who surpass a certain income threshold from 2 years prior actually have to pay more than $164.90 a month for their Part B. So again, really important that we have these conversations with the individuals as they approach 65 to make sure they understand what the implications are, what the costs are as they go into Medicare. So when somebody turns 65, here's some things they need to keep into consideration. And when you're starting to have those conversations with your employees, you'll want to figure out, well, number one, are you going to keep working? And keeping working and enrolling in Medicare depends on the size of the employer, whether or not we need to enroll in any part of Medicare. Okay. Of course, we want to have the conversation of, are you currently contributing to an HSA and do you want to continue doing that while you're working? Of course, we want to figure out, do you have a spouse or dependents who are on your group plan, and what are the implications if you decide to drop off of employer coverage and take a Medicare plan? We want to figure out, are you collecting Social Security? Because the process of enrolling in Medicare is different if you're collecting Social Security versus not. And a key question here, as I mentioned, the rules are a little different when you become Medicare eligible due to disability versus turning 65. We really want to have a firm figure on the number of employees you have. And I know there's a survey that is sent out regularly by the insurance companies. They want to know what the current list of employees are on your rolls, because it plays into a coordination of benefits. You know, who's supposed to pay first on claims. So for a large group, which is considered over 20 employees in the eyes of Medicare, this is general rules if you're turning 65. Okay, so for over 20 employees, if you have somebody who is turning 65 and they're going to continue working, they need to be offered the same coverage as the employees under the age of 65. And here's the real key. This is the impetus for this whole thing. If they're enrolled in a high deductible health plan and contributing to an HSA, they cannot have either Medicare Part A or Part B. Can't have it. And I am fighting fights, and I know I know Kathy's having these discussions as well, where somebody comes to you and says, "Well, no, I was told that I have to get Part A or else I'm going to get a penalty, and I might as well pick up Part A because there's no cost to it." Well, as soon as you do that, you lose the ability to contribute to your HSA. So you got to be very, very careful there. And one thing we like to remind folks is we want to make sure that the prescription coverage that's offered through the employer group is considered creditable. Not credible, not believable coverage, but creditable, which means that you get credit for it being as good or better than what Medicare requires. And I'm sure you're aware of the fact that you have to send out those creditable coverage letters each year to the employees once they turn 65. If you're having a conversation with somebody, please encourage them to keep a file folder with those creditable coverage letters in them, because down the road, when they decide to pick up a Part D plan, they need to have proof that they had creditable coverage. The government may try to stick a late enrollment penalty on them if they can't demonstrate that they had drug coverage that met the standard since they became Medicare eligible. Now, a large group, when you turn Medicare eligible due to a disability, it is different, okay? In order to kick the can down the road as far as enrolling in Medicare A and B, when you become Medicare eligible due to disability, you can kick the can down the road if the group is over 100. So it's different, okay? So if you're talking to somebody and they're 47 years old, but they're getting Medicare because they were disabled for 24 months. You got to make sure, check on the size of the employer group. If you're teetering on the edge there, if you're under 100 employees, those folks need to pick up their Medicare A and B and stop contributing to an HSA, because Part B, Medicare is supposed to pay first when you have a group under 100 employees with disability. When it's a question of turning 65, 20 is the threshold. So for smaller groups, less than 20 employees, or for folks who are becoming Medicare eligible due to disability, under 100 employees, those folks do need to enroll in Medicare A and B because Medicare is the primary payer on their claims. And I would urge folks who are in this situation, okay, not to mess with this, okay? And again, if you're teetering on the edge of 20 employees, you really want to make sure that you have accurate accounting of the number of employees that you have. Although somebody who's in this situation, who's going to keep actively working, may not be hit with a penalty for not taking Part B, because Medicare is supposed to be the primary payer on claims, you get down the road, and I have seen this happen more than once. Somebody who should have picked up Medicare, the insurance company does an audit of their claims, and they realize, hey, wait a minute, Fred was working for ABC company that only had 16 employees since he turned 65. We want that money back because Medicare was supposed to pay first on these claims. So don't mess with this, even though there's a Part B premium that has to be paid in that. You can get into a real sticky situation if you don't pick up Medicare under 20 employees. And of course, with that, HSA contributions need to end. And same as the larger groups, that creditable prescription drug coverage is very important. Got to keep stock of those creditable coverage letters. So when Medicare and HSA collide, what happens? So if you're working, you have an employee that's going to continue working past the age of 65, there is no requirement for them to enroll in Medicare A and B past the age of 65 if the employer has over 20 employees. Believe me, it's true. They'll argue. They'll say, no, I've got to get Part A. No, you don't have to get Part A. And if the employee is not collecting Social Security, they're not automatically going to be enrolled in either part of Medicare. So if somebody is not collecting Social Security, they would need to actively apply for their Medicare benefits. It's not going to happen without their action. So what happens a lot of times is, oh, I'm turning 65. I better call Social Security just to make sure that I'm set. Well, unfortunately, Social Security doesn't ask the questions. They don't ask an employee, well, are you going to continue working? What's the size of your employer group? Are you contributing to an HSA? Generally, you're going to be speaking to somebody who has, who knows how much training. Of course, you never know who's going to answer the phone. And they're going to say, well, you should pick up Part A because there's no cost. And that way you're not going to get any penalties down the road. And now this person who, otherwise would have just rolled along, maybe picking up Part A under the mistaken thought that they have to. And then we get into some issues with their HSA contributions. So believe me, an active working employee who is covered under an employer-sponsored health plan has no penalty for delaying enrollment in Part A or B of Medicare. If the employee enrolls in Part A by mistake, they can disenroll as long as they're not collecting Social Security. Again, I've seen this happen where somebody, well, my cousin told me to pick up Part A, so I picked up Part A, but I want to continue contributing to my HSA. Okay, you can contact Social Security and turn that off and then, be able to contribute to the HSA. Now, if a covered spouse is under the group plan and they enroll in Medicare, as long as the employee is not Medicare enrolled and going to continue working, if they keep their spouse on a couple plan or a family plan, they can continue contributing up to the family maximum if the spouse remains on their plan. So as we're getting ready for retirement, this is where things get a little bit complicated. We urge folks to try to plan ahead, because let's say I'm 70 years old and I decide I'm ready to retire, and I'm deciding in October that I'm going to retire at the end of the year. Well, we're going to start enrolling in Medicare, but Part A of Medicare backdates 6 months. So in order to avoid any complications, we urge folks to turn off their HSA contributions 6 months before they retire. Okay. If you miss that, if excess contributions are made because, we made the decision to retire sort of, a knee-jerk thing, those excess contributions can be backed out of the HSA account without a penalty, as long as we're doing it before the tax filing for that year. And this is a question that gets asked quite a bit about, well, how much can I contribute? And I'm going to show you a scenario with this. The thing to keep in mind is you can only contribute the maximum amount for the number of months that you're eligible to contribute. Okay, so let's say I'm retiring in October and my Medicare A is backdating 6 months. Prior to that 6 months, I can't put in the max amount for the year. I can only put in the prorated amount for the eligible numbers. And the illustration, I think, will make that a little clearer as we get in here. So here's a couple of scenarios. First off, this is Stephen. Stephen is 70. He's been actively working on a high deductible health plan. He has been contributing to his HSA. He's got a nice little nest egg in there, but it's time to retire. Okay, and he's going to start collecting his Social Security starting in October. Okay, what happens? Stephen should stop contributing to his HSA after March, okay, because his Part A is going to backdate 6 months from October. The most he can put in for the year is $12,250. So why is that? Well, because he has a maximum contribution since he's over the age of 65, his max contribution for the year is $48.50, but he can only put in $48.50 divided by 12 times the number of months that he is eligible to contribute, January, February, March, 12,1250. That's the most he can put into his HSA for the year. He now will need to apply for Medicare A and B, and his Part A will backdate to April 1st. His Part B will be effective October 1st. Okay, so it gets a little confusing, right? And believe me, if these situations come up, that's why Kathy and I exist. Okay, we are here to help navigate these waters if you have questions when these scenarios come up. But I think this is, if you'll get a copy of this PowerPoint and you can look up Stephen as a reminder for how this is going to work. Okay, so here's Judy. I named Judy after my mom. Judy is turning 65 in February and works for a smaller company. There's only 16 employees. She is contributing to an HSA and has no intention of retiring for at least a few years. So what happens with Judy? Well, she's going to have to stop contributing to her HSA after January because she's turning 65 in February. So her maximum contribution for that year, unfortunately, is only $404.17. Medicare is going to be the primary payer on her claims because she's working for a company under 16 employees. So she has to enroll in Medicare A and B and start paying her Part B premium. Now we want to verify that her drug coverage is creditable. And in a situation like this, in particular, it's a really good idea to have a conversation with these folks who are going to keep working about whether or not financially it makes sense to stay on the employer plan or jump off and join one of those Medicare Advantage plans that I was talking about at the top. Because the HSA, you're in a high deductible health plan and now you can no longer contribute to an HSA, and you're going to have to start paying your Part B premium, $164.90 a month. Maybe this high deductible plan isn't a great fit for your needs going forward. So, let's have that conversation and see, is this really the best route, or can we save you some money by looking at a Medicare Advantage plan perhaps, even though you're going to keep working? Okay, here's Ravi. Ravi is not happy. Okay, Ravi works for a large employer. He contributes to an HSA and he's turning 65, but his brother-in-law told him he has to pick up Medicare Part A or else he's going to face a penalty. So we have to remind Ravi, his brother-in-law is wrong. There is no penalty for not enrolling in Medicare A and B while he's actively working. And if he listened to his brother-in-law and enrolled in Part A by mistake, as long as he's not collecting Social Security, he can request to have that turned off so he can continue contributing to his HSA, and he can keep doing that right along until 6 months before he wants to retire, because we know his Medicare A is going to backdate. And of course, we want to verify that his drug coverage is creditable, so he's not accruing a Part D late enrollment penalty. But as long as his drug coverage is creditable, he's going to keep working. He's not collecting Social Security. He can just roll right along, maxing out his HSA contribution until 6 months before he decides to retire. All right, so a couple of resources here. If somebody is ready to retire and they want to pick up their Medicare A and B, they do that through Social Security. Even though it's Medicare, and once they enroll in Medicare, the governing body is the Centers for Medicare and Medicaid Services. Making that initial application for Part A and B is done through Social Security, either on their website, over the phone, or making an appointment at the local Social Security office. If they apply online, it's really a pretty straightforward application. They walk you right through it. You create a My Social Security account, and it takes probably about 20 minutes or so to apply for Medicare through Social Security's website, even if you're not going to start collecting Social Security benefits. Kathy and I are here to help. It's very confusing and very frustrating for a lot of folks, okay? So we offer services such as one-on-one consultations with your employees. We are very happy to come on site and do educational presentations, walking folks through the basics, the rules, what Medicare is, what are the costs, what's available as options. We do this all the time. So we are happy to do this either in person. We could do it as a virtual presentation as we're doing today. We are starting to put together a few Medicare basics online presentations kind of after work hours and as lunch and learns. So we'll pump those messages out when we've got something on the calendar, and you can encourage your employees to sign up for those educational seminars as well. As Kathy mentioned at the top, I work on both the Medicare end of things as well as the New York State marketplace, which if somebody is looking to retire and they're not 65 yet and concerned about what coverage is available to them, I can help out with that as well, or if they have children that are aging off of their plans, that sort of thing. We do comprehensive one-on-one plan reviews with folks based on their individual needs, their drug coverage, their medical needs, their travel needs, and we do work with a wide variety of plans here in Western New York. We do offer sort of an optional thing that helps us do our homework to help point people in the direction. This is just a sample of our assessment form that we provide and a sample of the different plans that we work with, our contact information, and some other resources that are available. Medicare.gov is actually terrific. I think it's laid out really well. There's a lot of good information on there, and it kind of reinforces what we've been talking about as far as the rules. So if somebody has questions about, what they need to do, what their costs are, Medicare.gov, I think, is actually set up pretty well. We mentioned the Social Security website, and then when somebody retires and they have Part D coverage, Epic is a godsend. The New York State Elderly Pharmaceutical Assistance Insurance Program is available to folks who meet certain income parameters, which are actually pretty generous, more generous than they used to be. So we can talk to folks about assistance with Epic as well. I've done a lot of talking. I'm ready for any questions that you may have.
Paula, I just have one here in the Q&A box, and it's a quick one. This information is good. They want to know for all states, correct? Not just New York State.
Yeah, so the HSA rules, these are all federal. These are federal guidelines, the HSA contribution limits. This is all federal, and the resources where I got a lot of this information, as I mentioned, the HSA legislation came in with the Bush administration, and it was actually that legislation too that led to the Part D requirement that went into effect in 2006. So yeah, these rules that we're talking about are federal.
Okay, no more questions that have been sent ahead of time.
Okay. We've got, a little bit of time here. So if you think of something and you want to throw it in there, I do want to mention, Kathy and I put together a nice information sheet on HSAs and Medicare. We put this together a couple months ago, and it does have some different scenarios on it. If you're interested in receiving that flyer, we can certainly pump it out to you. Just reach out to us or to your benefits consultant on the commercial side, on the employer benefits side. They have access to that as well. So we're happy to provide any resources that you need. And I do think that little sheet does a nice job of kind of encapsulating what we've covered here as well.
Yep. So if there are no more questions, thank you to everyone who joined us for today's webinar. We hope you enjoyed the presentation. Next week, we're going to be wrapping up our series with one final webinar, and that is the power of prevention, mitigating workers' comp risks through safety and the best practices, presented by Joe Coniglio, who's the president of OSEA Incorporated. To register for next week's webinar, same as you did for this one, visit walshduffield.com/all-that-jazz. So thank you again for attending. Thank you, Paula, for everything that you've shared. And if there's nothing else, oops, I see another question is just popped.
Sneaky.
Okay. Great presentation. Thank you.
Oh, thank you.
So with that, I think we'll close. Thanks again, everyone. Have a great day.
Thank you.